before and after having breast implants removed.
Thank you very much for inviting me to speak today. I want to start with a disclosure. The National Center for Health Research does not accept funding from medical device or pharmaceutical companies, so the center has no conflicts of interest. My father worked for Johnson & Johnson most of his career, and I inherited stock in J&J when my parents passed away. And so to make up for that bias, I do want to mention that Mentor lost track of 85% of their patients in their post-market studies, and that is the worst track record of any of the manufacturers. So my perspective is as a person trained in epidemiology from Yale Medical School. I was on the faculty at Vassar and Yale, was a research director at Harvard before coming to Washington, and I'm a peer reviewer for multiple major medical journals. So I take research very seriously, and I am going to talk about the research that we've recently completed. I want to start out by saying that implant manufacturers, when they submitted their studies to the FDA, they intentionally excluded women with a history of autoimmune disease from those studies. And we know that because they admitted it, and as a result, the manufacturers' breast implant booklets, which are required by the FDA, currently say some variation of this. Caution: notify your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. And then the first thing they list is autoimmune disease, for example, lupus and scleroderma, unquote. Unfortunately, the FDA website does not include that warning, and women tell us they haven't heard it. In 2005, when FDA looked at studies submitted to them by the manufacturers, the Allergan data from 2 years found an increase in the following connective tissue disease categories: general issues, muscle weakness, joint pain, and skin symptoms, meaning things like rashes. Similarly, for Mentor, there were significant increases in fatigue, exhaustion, joint swelling, frequent muscle cramps, joint pain, and fibromyalgia among augmentation patients. And in both cases, the statistician made it clear this was not due to age. So they compared women just before getting breast implants, those same women 2 years later, controlling for age. And yet, as you know, the FDA, the manufacturers, and the plastic surgeons have continued to state there's no definitive evidence of systemic health issues from implants, despite those significant increases in symptoms that were submitted to the FDA more than a dozen years ago. There have been other studies of systemic illness, and you've heard about quite a few of them. I want to specifically mention the Tufts report, which was quoted a few times, because the Tufts report is based on a summary of other studies, and those other studies have some major flaws. Many of the studies included women who had implants for less than a year, or less than 2 years, or less than 3 years, and as you've heard, these symptoms develop later. Many of the studies had small numbers of women. Most of the studies were looking at rare diseases, but not studying symptoms. And some of the studies even focused on hospitalization records. And women with joint pain and mental confusion aren't going to be hospitalized. So hospital records are not a good way to measure them. And the other ones mostly looked at medical records, which did not necessarily include the symptoms that the women were reporting. You've just heard about the Israeli study that was published last year, which did find a significant increase in Sjogren's syndrome, multiple sclerosis, and other disorders. So the National Center for Health Research conducted our own study. We have already been helping over 6,000 women who had reached out to us asking for help getting insurance coverage for medically necessary explant surgery. These were women who wanted to have their implants removed and not replaced. So we contacted the 792 of those women who we knew had removed their implants in 2016, 2017, or 2018. Keep in mind, we were already familiar with their medical problems. We had seen their medical records and or their letters of medical necessity to their insurance companies, so we knew that these women were very sick. And they were desperate for help because they couldn't afford to get their implants taken out. They didn't have the money to do that. We emailed them with a link to an online survey starting this past November and ending in January, and 57% of those women, 449, filled out the questionnaire. We asked the women why they wanted their implants removed, and 54% said because of breast pain, 34% said because of breast hardness, bless you, 27% said because of rupture, and 85% said because of other health issues. I'll talk about that in a minute. Here's our table one, just gives the usual typical information about demographics and some information about their implants. I will go over the highlights. The women ranged in age between 24 and 82 years old with a mean of 49. 93% were white. 3 out of 4 had implants for at least 10 years. And only 21% had more than 2 breast implants. In other words, they had gotten implants and they'd been replaced. 48% had saline implants only, 39% had silicone gel implants only, and 12% had had both. Again, those are women who had more than one set of implants. And these were all augmentation patients. Then we asked how long they had had these health symptoms before they had gotten their implants removed. And you've heard a little bit about this today, that a lot of times these women have symptoms and problems for years before they get their implants out for a variety of reasons. For the women in our study, 59% reported that their symptoms lasted at least 5 years. So that's the red and the blue in that pie chart. 28% reported that their doctor told them after their implants had been removed that their implants were ruptured, so that's a definitive diagnosis. 56% reported that they had had either an en-bloc surgery to remove their, had an en-bloc surgery to remove their breast implants, and an additional 26% reported having a total capsulectomy. For those of you who don't know this, these are the ways of getting the maximum amount of the scar tissue removed. And since the silicone and other chemicals can get into that scar tissue, many of us believe that that's very important to get as much of the scar tissue out as possible. We also asked about family history. 69%, which seems like a lot, reported some kind of family history of autoimmune disease. There's some confusion about what are autoimmune diseases. We gave some examples, but we can't say for sure that that's exactly right, but it gives you some sense of what's going on. Only 3% of the women reported a personal history of autoimmune disease, but 12% had said they had some possible symptoms before they got their breast implants. And then just over half, 51%, reported that they were diagnosed with an autoimmune disease after getting their breast implants. We asked them exactly what symptoms they had had, and this was an open-ended question. We didn't want to influence it in any way, so it was open-ended, and then we categorized them as best we could. The most common symptom was joint and muscle pain or weakness. Number 2 was fatigue. Number 3 was what the women call silicone brain fog, which is memory and concentration issues. You've heard about that as well. Number 4 was anxiety and depression. As I have to say, you never know, is that a autoimmune type of response, or is that a response to all the other health problems that they're having? Number 5 was hair loss. Number 6 was breast pain. Number 7 was rashes and other kind of skin irritation and skin problems. Number 9 was general body pain, overall body pain, fibromyalgia type of problems. and number 9 was gastrointestinal problems. And those are really the most common. There certainly were others, dry eye, allergies, and other symptoms. We then asked them, you've now told us what your symptoms were. Did they get better, worse, or about the same since having your implants removed? And you can see that almost 61% reported that they got much better, 29% that they got somewhat better, 8% said they stayed about the same, and just under 2% said they either got worse or much worse. And then we tried to figure out, could we predict who was going to recover more? So we looked at all the variables we had, and independently looking at each one, we found all of these were statistically significant predictors. And so, for example, having implants for more than 10 years, those women were less likely to fully recover. Having had autoimmune symptoms before they got their implants also reduced the chances of the women recovering. Having a rupture or a leakage as the reason for having their implants removed also predicted a less good outcome. And some of the other things are a little bit confounding, so I won't go into that. But the last one, en bloc or total capsulectomy for removal, predicted a better outcome. And you can see highly significant. But as many of you know, if you look at enough variables, something's going to come out significant. So we threw them all together into a logistic regression so that we could control for that confounding. And what we ended up with was 2 variables that still predicted when everything else was controlled. And one was a family history of autoimmune disease, which predicted a less good outcome, and an en bloc or total capsulectomy removal, which predicted a better outcome after removal. So, in conclusion, we've talked to and helped more than 6,000 women who wanted to get their implants removed but were having a hard time because they couldn't afford it. And many of those women had problems for many years before they finally got their implants removed. The symptoms and the diseases that the women are reporting fit in very well with what's called breast implant illness, and they're very similar to the same kinds of symptoms that have been reported in studies submitted to the FDA in 2005, as well as reported by more than 70,000 women on Facebook. A family history of autoimmune disease and the number of years with implants significantly predict a poorer recovery after explant, and how implants are explanted, how much scar tissue is removed, and how carefully seems to have a significant impact in improving the likelihood that women will have a good recovery. So this has clear implications for some of the issues you'll be talking about, and we have been talking about. And informed consent is a big one. So we conclude that women need to be warned about the possible role of family history and personal medical history. Obviously, our sample is not a random sample of women. It's a sample of women who wanted to get their implants out and were able to get them out. But for those women, and there's thousands of them, there seems to be a relationship with these family history and personal medical history. We believe that women need to be informed that systemic symptoms may be caused by implants. Again, this is not a random sample of patients, but there are thousands of patients who have contacted us with those problems, as well as the 70,000 women on Facebook and other social media, and the women that you've heard from today. We think that women need to be informed that an appropriate explant surgery can significantly improve their health, because we hear from the women that they're told by their doctors, it has nothing to do with your breast implants, and taking your breast implants out won't make a difference. what we always tell women when we talk to them is there's no guarantee that taking implants out will improve your health, but that for a lot of women it does. And then finally, we're very concerned about what information is going to be in the registries. Registries could be a very good source of data, but only if they include some of the things that are not yet in there. One of them is women's self-report of systemic illness or any other kind of medical reports of systemic illnesses. But also, currently, the registry is focused on operations and reoperations and explant operations, and what we're finding is that many women just can't afford it. So if our registries only look at the women who've had those operations and thousands of women aren't getting them, it can't really provide the information that we need to make progress in figuring out how many women are getting ill and what's happening to them. And that's all, and I'm of course happy to answer any questions, as I'm sure the other panel members are. Thank you.
Thank you, Dr. Zuckerman. I'd like to